Hey everyone, so today we'll do another mock USMLE question. This is going to be question number 18. So the question today is, you have a 47-year-old female, past medical history is notable for type 2 diabetes mellitus, high blood pressure, provoked DVT, who comes to the clinic for annual physical examination. Patient denies any acute complaints, but inquires whether she's due for a mammogram. Patient states that she's concerned about breast cancer as a close friend was recently diagnosed with it. Patient denies any family history of breast cancer. Her home medications include amlodipine and metformin. Otherwise, temperature is 36.2, blood pressure is 132/94, and pulse is 76 beats a minute. Physical examination is unremarkable, with no palpable breast masses. What is the most appropriate recommendation regarding need for mammogram? The options are schedule a mammogram, order a breast ultrasound, provide reassurance, or do BRCA testing. If you need more time, go ahead and pause the question right here. So the correct answer is provide reassurance. In order to answer this question, you do have to know the screening guidelines for breast cancer. The recommendation with regards to breast cancer is that you start screening at the age of 50 and then at 74. So between 50 and 74, you do a mammogram every 2 years. So given that this patient is younger than 50, she's 47, at this point, a mammogram wouldn't be recommended. And particularly given that there's no significant family history of breast cancer, patient doesn't have abdominal, doesn't have a breast mass, a mammogram currently wouldn't be indicated. So once again, for this patient with no family history of breast cancer, no known risk factors, the general recommendation would once again be to do a mammogram starting at age 50 to 74 every 2 years. Now, one thing I just wanted to briefly point out with this question is it's very important to learn the screening guidelines. Those get tested very frequently, particularly for breast cancer and cervical cancer. In the next slide, actually, I'll go over some of the more commonly screening guidelines that I feel like you should know. These are ones that I've seen come up repeatedly. So in terms of screening guidelines, the first one I want to go over is for abdominal aortic aneurysm. So the general recommendation is for anyone who has a history of smoking, particularly in men, you do a one-time abdominal aorta ultrasound between the ages of 60 and 75, just a one-time screen. Next, where we talked about for breast cancer, for women between the ages of 50 and 74, you do a mammogram every 2 years. Next, for cervical cancer, the general recommendation is you essentially do screening for cervical cancer from 21 to 65. However, the guidelines are different and they change that roughly when the patient is 30 years old. So between 21 to 29, you do a pap smear every 3 years. From 31 to 65, you can do a pap smear every 3 years, or what you can do is do a pap smear plus HPV cytology every 5 years. So once again, for cervical cancer, 21 to 65, you can do a pap smear every 3 years from 21 to 30, and starting at 30, you can do a pap smear plus HPV cytology every 5 years. And then lastly, for colorectal cancer, between the ages of 50 and 75, you can do a colonoscopy every 10 years, a sigmoidoscopy every 5 years, or a combination of fecal occult blood tests and sigmoidoscopy every 5 years. So these, once again, are some of the more high-yield screening guidelines I've seen come up repeatedly. This by no means is an exhaustive list, and actually down the road I'll try to create a quick presentation with the really high-yield ones that you should know. This is just a brief list, but I'll try to create a lecture down the road with the really high-yield screening guidelines. But these ones, you should definitely take the time, take a couple of minutes to memorize these because these are incredibly high-yield and come up repeatedly. And so I think that's going to be it for today.